Hello to everyone, uh, viewers. In my series of discussion, since we are knowing that Corona has badly affected we all in the entire nation, and we can say, or in world also, all are affected. But other in other parts of the world, they have their population is less and they have due to them all maximum their persons have been vaccinated, but India, our country, is very big, and most of the areas are very rural area where there is a lot of lack of awareness, and people are not having a good hygiene conditions. So this is a matter of concern that despite of so many initiatives, and the only hurdle that our country has a vast population of nearly 136 137 crore, and it's not possible for the government to vaccinate and provide a hygiene condition to each and every citizen within a stipulated time frame. So it is a need of the hour to educate the people in rural areas who will further percolate those things to the these illiterate people who are living in very remote areas, that they should follow some protocols, good hygiene conditions, so that at least they should not be further, the disease should further spread, or we can have a control over the this corona pandemic. So in today's discussion, my main concern, earlier also 3 4 videos I have made in this black fungus, that is mucormycosis, and a lot of that I have in that video I have made a detailed talk that how this uh, black fungus, that is mucormycosis, was earlier detected in Maharashtra, and the patients were found suffering from this this black fungus or mucormycosis, where earlier they were treated from COVID, and now after getting recovered again, there these symptoms of this mucormycosis, that is black fungus virus, were found, in which there is a blackness in their below the eye, or you can say this swelling of face, toothache, and this ulcer, pain in stomach. So these are the symptoms where they have made a data of such patients suffering from this mucormycosis, and uh, doctor, while treating this upper jaw, were fully removed, because if could not have removed, the virus could have reached to the brain, and that time it was very no chance to at least save. So many people have lost their eye vision, and loss of life have also been seen in this mucormycosis symptoms. So today, and I have told that this disease, that black fungus earlier in Maharashtra, then it was seen in Uttar Pradesh, then in Karnataka, Kerala, and many other parts of the country. Now, further a case of this white fungus along with this black fungus has been seen, and this it is called that it is both this white fungus and black fungus are caused by fungus mold, so called mucormycetes. And first of all, let us know what is this white fungus, and what is this black fungus. So white fungus, this may infect brain, respiratory organs, our digestive tract, then kidney, then nail bed, or even our private parts of the body. Uh, and the mucormycosis, that is black fungus, can affect the face, injecting nose, infecting our nose or bit of eye or brain, which can cause even vision loss. So, four cases of such that this latest mucormycosis were found in Patna, and the experts, while taking diagnosis of those patients, they have said that the fungal infection could be more dangerous than the black fungus. These four cases, the patients were suffering from this white fungus, and on diagnosis, it is found that it is more dangerous than this black fungus. Meanwhile, uh, in all the parts of India, it has been witnessed that there is rise in the case of mucormycosis, uh, or obviously this is known as black fungus. Earlier, everyone was treating this mucormycosis as black fungus. So our government has also advised to make mucormycosis a black fungus, a notified disease under the Epidemic Disease Act, stating that infection seeing in this is a prolonged morbidity and mortality. So we can say that, however, the whole fungus found are more deadly from the this black fungus, that I've already earlier told that they are more dangerous. And on further on study, it is reported that this newly detected fungal infection poses a risk to patients who are on oxygen support, or is causing this other injections. And so but this oxygen support, during oxygen support, there's a lot of humidity, and so that is causing, and that due to this humidity, and that is causing skin damages. So both white and black fungus infection are caused by fungi molds called Mucormycetes, which are present in the environment. So, this COVID uh, virus, the World Health Organization also that it is present in aerosols. Similarly, this white and black fungus, known as this fungi molds, are present in the environment. The white fungus infections are more dangerous than black fungus due to its acute effect on lungs and other body parts, and cause great damage of the vital organs. It may impact brain, respiratory organs, digestive systems, kidney, nail bed, and other parts of the body. And in case of black fungus, it has been increased with COVID 19, and the patients who were being given steroids, excess steroids, we may can say misuse of steroids. So that were under this humidity due to oxygens, all the due to these regions, this black fungus uh, were detected, and the disease micromycosis can affect the face, infecting nose, eyes, or brain, which can cause even vision loss. So it is seen that secondary infection, fungal and bacterial, are causing more mortality. Further, in white fungus, mm, it is more likely to infect people with low immunity. So earlier also in black fungus also it has been detected that people who are with low immunity, they are being affected by this mucormycosis, that is black fungus. It can also cause if people came in contact with water or unsanitary environment containing molds. So it is very much required that we should not allow water to uh, collect anywhere, because this gives rise to this fungus. So such persons is said to be vulnerable to the infections, since these molds can be easily inhaled by a patient. So the fungus can further spread to vital organs and cause further complications. So major risk factors for the disease include uncontrolled diabetic, uh, immune suppressions by steroids, and prolonged ICU stay, and this other medical therapy, because due to all these things, some humidity is collected in the patients and they cause this fungus or molds. So symptoms and treatments of this fungus, it was found that in the four cases which were found in Patna, uh, then they were earlier have COVID symptoms, and further also when they were suffering from this fungus, so the symptoms were like this COVID, and their lungs were affected, and the symptoms were more or less like black fungus. So this fungus affect lungs and chest, and it may lead to cough, chest pain, breathlessness. So the infection which cause these inflammatory symptoms and can cause swelling, infections, persistence, headache, and pain. Such patients, that is who has that white fungus, are given antifungal medicines, and later on they are recovered. Further, what are the let us discuss what are the symptoms and treatment of black fungus. So, in here in black fungus, the infections are causing this blackening near below the eye, discoloration over the nose, blood or double vision, chest pain, breathing difficulties. These are the symptoms of black fungus. This mycormycosis predominantly involves the sinus and the eye, and further it reaches to the brain, and that is very dangerous stage. So this antifungal drug which are given, this name is amphotericin B. It is being used to treat the black fungus. Normally, these are the medicines which I have, while going through, the same medicines were given the patients who were suffering in Maharashtra, and in Uttar Pradesh also the patients were same medication were given, because now this is the medicines presently being devised. Later on, further medications are being on research. Necessary precautions to prevent black fungus. With the for this, the health department had cautioned against this having this exposure to this decay bread, uh, the bread etc. which are taking, we should not allow them to decay. Fruits and vegetables should not be allowed to decay. Besides soil, this compost and bacteria, this in rural areas, these farmers are advised to wear this gloves, and this in leg also they said wear shoes or like that, so that their body parts should be protected, and people must maintain their good hygiene condition. They should maintain their personal hygiene, and while taking bath, they should give thorough scrubbing in all the body parts, so that any infection which is going to collect should be removed immediately. And it is advised that during bath we should take warm water. It will also help in removing and killing the these viruses. Further, the fungus enters the skin through a cut. Suppose we have any cut or burn or other types of skin trauma. So through this fungus enters. So use of marks is necessary, uh, especially during dirty construction sites. So suppose any construction activity is going on there, we are supposed to wear, cover our face, use mask. So and further it is advised to reduce the dose of steroids and discontinue immunomodulating drugs and infuse normal saline before giving this amphotericin B infusion. So it is very much required that before giving this amphotericin B, normal saline should be given. And further, patients should be monitored clinically and with radio imaging for response and to detect disease progression. The blood glucose levels should be monitored, like post COVID 19 discharge. Suppose any patients are being discharged after getting from this COVID 19, then it is advised that their blood sugar level should be immediately monitored for certain period after getting recovery, as well as regular examinations to find out this warning signs, as stated above. Besides this mentioning judicious use of this steroids and antibiotics. So, because in the all cases it is found that this black fungus or is mainly due to excess use of steroids, humidity due to taking oxygen, and a lot of other this use of antibiotics, high antibiotics and overdoses. These are due to some of the reasons to cause this black fungus. So the Chunki the reason for taking this discussion of black fungus is mainly due to this increasing cases in almost every parts of the country, and in Patna this white fungus cases has been detected. That's why I have make detailed discussion on black fungus, mucormycosis, and this white fungus also, that is Mucormycetes. With all this, I hope the discussion which I have made on black fungus and white fungus must be of informative, and we all are mainly to keep a watch on ourselves, make a good hygiene condition, as advised in the reports that while any farmer is working in the field, they should wear gloves. In the legs should also not be naked, and while taking bath, we should scrub whole parts of the body and take this warm water. Make other gargles, etc., and less use of steroids. When excess dose should not be given, and this antibiotics, etc., should be given the which is actually needed. And with all this, I am making end of today's discussion. I give my sincere thanks to you all viewers for careful listening. Thank you very much.